Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Health Sciences, SOHS, Certificate in Phlebotomy Assistance, CPHA, BHT 011 Basic Phlebotomy Assistance, Block-1 Introduction to the Phlebotomy Assistant Program, Unit 1 Role and Responsibilities of Phlebotomy Assistant. 1.0 Objectives. At the end of this unit, you should be able to define phlebotomy, describe important skills that is necessary for phlebotomy assistant, describe major responsibilities duties of phlebotomy assistant, describe personal qualities of phlebotomy assistant, describe the importance of drawing a good quality sample, and describe the importance of safety protocols in a healthcare setting. 1.1 Introduction. In today's era of integrated health delivery system, allied health professionals play a key role in quality patient care. In diagnostics, successful sample collection has a vital role in patient management. The purpose of this program is to provide technical skills and develop special qualities for becoming a member of a healthcare team as phlebotomy assistant. In this training, you will learn highly skilled technique along with comprehensive knowledge of current healthcare environment. In this chapter you will learn about the job profile of a phlebotomy assistant, including the professional behavior. 1.2 Phlebotomy and phlebotomist. Phlebotomy is the practice of collecting or drawing blood. A phlebotomy assistant is a member of healthcare team who obtains blood samples for laboratory testing. Today, phlebotomy is performed to taking blood sample for diagnostic purposes and to monitor prescribed treatment, collection of blood from blood donors in a blood bank for giving transfusion to patients. Therapeutic phlebotomy is removal of blood for treatment of polycythemia, a disorder involving the overproduction of red blood cells, and hemochromatosis for removal of excess iron within the body. Phlebotomy is primarily performed by one of two procedures: eye venipuncture, which involves collecting blood by penetrating a vein with a needle and syringe or other collection apparatus; 2. Capillary puncture, which involves collecting blood after puncturing the skin with a lancet. In some situations, arterial sample is needed, but arterial collection is dangerous and it needs extra skills usually performed by doctors and nurses. You will not be permitted for arterial sample collection. Phlebotomy assistant. Phlebotomy assistant is a healthcare worker who performs phlebotomy in healthcare settings. A phlebotomy assistant will work in clinics and laboratories. Her job is to assist medical laboratory technologists, doctors and nurses in order to exclusively take care of the blood collection process. 1. 3. Role and responsibilities of a phlebotomist assistant. Role and responsibilities of a phlebotomist assistant are given below. 1st March 2001 Job skills. He/she should be a skilled professional who needs following skills. 1. Technical skills are required to collect specimens for analysis. 2. You need to be highly organized and detail-oriented to deal with bulk of samples. 3. In situations of multiple tasks, you must able to prioritize tasks according to the workload. 4. Your interpersonal skills is needed to handle a variety of people. 5. Your ability to cope with stress in a calm manner is necessary for being a successful phlebotomy assistant. 1st March 2002 Role and responsibilities. The primary role of phlebotomy assistant is to obtain blood samples at the request of a physician or a qualified healthcare professional for analysis in the laboratory. The phlebotomy assistant independently cannot perform the extraction without any requisition, unless directed to do so. You have to perform following duties. 1. You have to fill out and interpret test requisition forms. 2. You need knowledge of electronic health records, EHR, and electronic medical records, EMR. 3. You have to prepare the patient before collection of sample. 4. Collect blood samples for test, procedures and with correct identification and labeling. 5. Prepare and transport samples at appropriate temperature without any damage and to ensure stability of samples. 6. Collect sample and perform test on point of care testing, POCT. 7. You may also work in situations that require collection of urine specimens, throat cultures and perform ECG. 8. Maintain patient confidentiality. 9. Understand hospital-borne infections and practices to curb them. 10. Identify shortage and overstocking of supplies. 11. Comply with all the procedures mentioned in SOHS, Standard Operating Procedure, SOHS, Manual. 12. It is your responsibility to brief the patient or donor about the process and pacify him/her in order to be able to conclude the process of removal and collection of blood in a smooth manner. Your professional skill must be able to 1. Put the patient at ease while collecting medical history. 2. Communicate with the patient adequately and in ethical manner. 3. Use technique to minimize pain and discomfort to the patient. 4. Understand and perform right methodology of labeling the extracted blood sample unit. 5. Assist the patient before, during and after collection of the specimen. 6. Promote good relations with patients and hospital personnel. 7. Assist in collecting and documenting monthly workload and recording data. 1.4 Personal qualities required. Phlebotomy assistant, PHA. Phlebotomy assistant, PHA, will be working as an assistant to doctors and nurses, technicians as a team members to carry out responsibilities given as you have learned section in 1.3. In this section we will discuss about the personal qualities of PHA. 1st April 2001 Qualities as a healthy individual. Healthy individual have sense of self, function as a team member and carry out own responsibilities successfully. Have self-respect, satisfied and aware of own strengths, weakness and try to grow to its potential. Let us list some of the qualities of healthy individual. Qualities of healthy individual. Think positive and plan for future. Attentive and observant. Have strong social circle and help others. Physically and mentally healthy. Have good memory. Active and work tirelessly. Self-development and improves self for learning new skills and update oneself. Take up responsibilities and carry out with positive attitude. Do not consider as burden. Self-motivated to come forward and do work, learn new things, extra efforts are put in do work in difficult situations. Healthy good look, take care of daily routines. Well groomed and dressed. Easy going and comfortable. Respect everyone and take care of working norms. Work in a team and adjust with all team members. 1st April 2002 Qualities as a team member in hospital. To work in team you need to have some of the qualities. Some of the qualities are given below. Honest and reliable team can trust upon, except if by mistake taken some wrong step while working in hospital. Empathetic with patient and family members of patient and shows respect to them. Straightforward and accept praise and criticism. Share responsibilities and confident. Reliable as team can depend for work, will be able to do multi-tasking, i.e., can do variety of activities or handle multiple tasks. Competent, know own work, carry out work efficiently. Good communication skills with team and patients. Positive attitude towards team, patients, family members of patient and work. Focus on work and share responsibilities. Use own strengths and overcome own weaknesses. Practice the skills to update and carry out work with competence. Motivated to perform daily tasks in hospital. Adaptable to situation and understand working environment, as PHA. Will be working in various units in a hospital. Manage resources effectively, efficiently and is punctual. Able to handle stressful situations in hospital and resolve conflicts with team members and patients if any. Some examples are given below for you to understand. Interpersonal communication skills. A PHA needs to consider the following while communicating with coworkers. Ensure that communication is precise and brief. Give facts and not opinions, unless specifically requested when you listen, pay attention. If others find fault in you, do not get angry. Think before you find faults in others. 2. Work etiquette. Follow the 5 rules of work ethics. You'll be a winner always. To be competent, the individual on the job must speak clearly and slowly in a gentle tone. Use language familiar to the listener. Give facts and avoid opinions unless asked for. Structure brief and logical messages. 3. Time management. For learning time management, you need to ask following questions to yourself. Are you always rushing with reference to job-related work? Do you try to do everything at the same time? If answer is yes, then you need to learn how to divide your tasks as per the priority and importance. What must be done immediately? Do it first and prepare yourself. What can wait? Let it wait for some time. Do them in between the important jobs. Finish your tasks on time. You will have more time for yourself. 4. Discipline. The real purpose of discipline is to encourage employees to establish standards of job performance and to behave sensibly and safely at work. Discipline is essential to all organized group action. Discipline should be viewed as a condition within an organization. As PHA, you also need to be disciplined while working in hospital. Honesty. You need to answer the question that, does honesty win in the end? Yes, it does. It is well evident that if you are dishonest, you may win at first, but it won't last long. Honesty is forever, you won't lose. Speak the truth. As for hiding one lie, you need to speak many lies. No one trusts a dishonest person. 6. Anger management. Do you know anger is like a dragon? If you do not control anger, it will swallow you. Here are tips to control anger. Following are the tips for control of anger and stress. Try your best to remain calm. Count 1 to 10 before you speak if you are angry and stressed. Say a prayer if you are upset. Forgive yourself and others. Forget the past if it made you upset or angry. Admit your mistakes politely. Do not let your anger grow within you. 1.5 Art of Care. Giving care is an art as you are dealing with human beings. You need to have following qualities. Empathy, understanding other person's point of view. Love for human beings as an individual with individual health needs. Compassion, understanding other person's situation, illness and have desire to help the patient and family. Kindness and providing skillful care. Keep patient information confidential and maintain privacy. No harm to the patients, therefore patient safety is very important. By Keeping environment safe and clean. Infection control protocols to be followed. Wash hands whenever enter patient ward or room or touch patient or carry out any procedure. Maintain dignity of patient, provide privacy during procedure, involve patient in decision making for treatment and care. Patient has right to say yes or no. Encourage the patient to take care of self, assist patient if required. Explain to patient about do and do not in hospital, give orientation to daily routine. Provide clean bed and environment to patient and provide comfort. Devices. Always verify the orders from doctors and nurses and verify from them before doing any procedure with patient like making bed, assisting patient in daily routine, helping in eating food, transferring the patient etc. Identify all equipments, their use and maintenance, follow all guidelines and protocols for procedures and infection control. Respond to patient and their family members, reply to their call and answer their questions. Do not give false information to patient and relatives and do not carry out any procedure which is not practiced by you like complicated dressing, minor surgical procedures, injections etc. Help your team in handling conflict situations, stand with your team in crisis and try to convince patient and family. Professionalism. You will often be the first person to meet patient in a healthcare team. So it is always good to integrate some personal qualities in your personality like friendliness, compassion and honesty. You have to maintain a balance with friendliness and professionalism. Professionalism shows your attitude for work, your conduct at workplace, and some special characteristics that mark your profession, which you need to display in your job. 1. Efficiency. Perform your skillfully, efficiently, and without constant supervision. Avoid all unnecessary absences or tardiness. 2. Honesty and integrity. Integrity is important. Report your errors yourself, whenever made, because unreported errors can do irreversible harm to the patient. 3. Positive attitude. Important in your interactions with patients and their families as well as other healthcare professionals. 4. Personal appearance. Your personal appearance is an important part of professionalism. Cleanliness and well-groomed look is mandatory at your workplace. Personal hygiene is of great importance because of the close proximity in which the phlebotomist works with the patient. Hands are the tools of the phlebotomist and are closely observed by patients. Nails should be clean and well trimmed. Nail polish is not allowed. Jewelry, cologne, perfume, and makeup is not allowed during duty. No piercing and tattoos. Dress should be clean, fresh, and wrinkle-free. Dress must not be revealing. Shoes should be polished and clean. Hairstyles should be sensible, no unusual hair colors. Helpfulness. You should be helpful to the patient, but you are not eligible to give any medical advice to the patient. You should never tell the patient about the indication and requirement of the test related to his/her disease. Don't talk too much about test and test results because patient may have emotional response to it. Compassion. It is empathy for a patient, i.e. desire and ability to understand someone's pain and want to somehow lessen that pain. Empathy is a necessary quality for phlebotomy assistant. This quality helps you to understand the reaction of patient in a particular situation. Your conversation with a patient should always be in a pleasant tone of voice. Compassionate and skillful phlebotomist is always in demand. 1.6 Importance of drawing quality blood sample for testing. Quality phlebotomy is necessary to ensure the highest quality patient care and consistent specimen analysis. Phlebotomy assistant is one who can best control the pre-analytical factors which affects patient care and sample integrity before testing. The crucial areas which affect the quality of blood sample are patient preparation, specimen collection, and transport. You will learn the important precautions and techniques necessary to maintain sample quality throughout. Along with each procedure, incorrect technique of blood sample collection leads poor quality sample and false results. Patient care can be compromised from wrong test results, so it is important to learn common pitfalls of collection. 1. Hemoconcentrated sample tourniquet application causes venous stasis or stagnation of the normal venous blood flow, which leads to hemoconcentration due to loss of fluid through capillary wall into tissues. Prolonged tourniquet application for more than a minute. Massaging or squeezing the puncture site multiple times, penetrating the veins and opening and closing, pumping fist repeatedly can result in hemoconcentrated sample which may not reflect the true status of patient. To prevent hemoconcentration, following precautions should be taken. In each blood sample collection, release the tourniquet within 1 minute. Ask the patient to open the fist upon blood flow and let it remain open. Select a suitable patent vein. Do not excessively squeeze or massage the puncture site. Do not probe or redirect the needle multiple times in search of a vein. 2. Hemolyzed sample. In hemolyzed specimen, damaged red blood cells (RBC) releases free hemoglobin in plasma or serum, which appears pink in slight hemolysis or dark red in gross hemolysis. It erroneously decreases RBC count and elevates potassium, iron, magnesium, phosphate, catecholamines, ammonia and creatine kinase. Wrong techniques that can result hemolyzed sample. Collecting sample through very narrow bore, gauze, needle causes mechanical trauma to RBCs. Collecting sample with small butterfly needle in a large vacuum tube. Collecting blood from a vein with a hematoma. In capillary sample, failed to remove first alcohol contaminated drop. Forceful aspiration in syringe and a forcing in a vacutainer should be done gently. Frothing of blood due improperly fitted needle in a syringe. Rough handling in transportation should be transported vertically, not horizontally. Mixing additive tubes vigorously, shaking them, or inverting them too quickly or forcefully. Inadequate filling of sodium fluoride tubes. Squeezing the site during capillary specimen collection. Syringe transfer delay, in which partially clotted blood is forced into a tube. 3. Incomplete draw. Vacationers should be filled till vacuum is exhausted. Failing to do so results in short draw. Short draw serum tubes or red top tube are acceptable if specimen is sufficient, but underfilled anticoagulant tubes compromised specimens. 4. Specimen contamination. Specimen contamination is typically inadvertent and results from carelessness, allowing alcohol or gloves, powder to contaminate specimen, using incorrect antiseptic to clean puncture site, and sweat contaminating capillary sample can affect sodium and chloride levels. 5. Collection in wrong or expired tubes. It can affect patient safety. 1.7 Need for safety protocols. The standard precautions in handling specimens to be followed are important. This will prevent the effects or biological, electrical relation and chemical hazards in healthcare settings. The details are given under 1st July 2001 Standard Precautions. In healthcare settings, biological, electrical, radiation, and chemical hazards are often encountered. Phlebotomist must know about the hazards and precautions necessary to avoid the hazards. Since infectivity status of patient's blood and body fluids cannot be identified beforehand, you need to follow standard precautions in handling specimens of all patients' blood, urine, and other biological specimens possibly contains pathogenic organisms, so any biological substance harmful or potentially harmful for health should be identified as biohazard symbol. The term biosafety is used to describe safe handling of biological substances and to minimize the occupational risk. One has to follow lab safety rules. 1st July 2002 General Laboratory Safety Rules. Don't do eating, drinking, smoking or chew gum in the laboratory. Avoid putting pencils or pens in the mouth in a laboratory. Don't keep food items or drinking water in a refrigerator used for storing reagents or specimens. Do not rub your eyes, handle contact lenses, or apply cosmetics in laboratory premises. Don't wear long chains, large or dangling earrings, or loose bracelets. Always wear a fully buttoned lab coat when engaged in lab activities. Never wear a lab coat during lunch, on break, or when leaving the lab to go home. Always wear appropriate personal protective equipment, PPE, during handling of laboratory specimen and remove it when moving outside the designated area. Always tie back hair that is longer than shoulder length. Always keep fingernails short and well manicured. Do not wear nail polish and never bite nails or cuticles. Always wear a face shield when performing specimen processing or any activity that might generate a splash or aerosol of bodily fluids. Always wear gloves for phlebotomy procedures and when processing specimens. 1st July 2003 Biohazard exposure routes. Healthcare workers can be exposed to biohazard substances by various means such as 1. Airborne inhalation of aerosols and splashes created when improperly fixed tube stoppers are centrifuged. To prevent it, practice safe handling of specimens and wear appropriate PPE, personal protective equipment. 2. Ingestion. Do frequent hand sanitization and avoid hand-to-mouth activities in laboratory area. 3. Percutaneous. To minimize the risk of percutaneous exposure, always use needle safety devices properly and you should wear industrial gloves while handling broken glassware. 1st July 2004 Emergency Management. In this training you will be trained in emergency first aid techniques. The most common types of emergencies and steps that should be taken are as follows. 1. Cardiopulmonary resuscitation, CPR. A victim of cardiac arrest needs immediate chest compressions, push down on the chest, right between the nipples, between 1/2 and 2 inches and at the rate of 100 per minute. Simultaneously send alert emergency medical personnel. 2. Excessive bleeding. From clean cloth apply direct pressure to a bleeding wound and elevate the limb if fracture is not suspected and ask for medical assistance. 3. Managing shock. In the case of suspected shock, identify early signs of shock: pale, cold or clammy skin, rapid pulse, shallow breathing, weakness, and possible nausea or vomiting. In such cases keep the patient lying down with elevated limbs. In case of vomiting, keep the Airway patent by turning head to the side and ask for immediate medical assistance. 1.8 Summary. In this unit, you have learned what phlebotomy is and who phlebotomist is. As a phlebotomist, you play a very important role in healthcare, and now you can explain what it means to be professional phlebotomist. Your role in different institutions may slightly vary, but all the above listed duties are within the scope of phlebotomist. So if you want to be a phlebotomist, besides having good technical skills, you need to incorporate all the compulsory characteristics in your personality and behavior to prove your worthiness and professionalism. The entire patient care depends upon the quality of blood sample drawn by phlebotomist. Any error in the diagnosis can replicate in management and do harm to the patient. Similarly, following standard precautions is important for your safety as well as patient safety. Thank you for watching. We will see you in the next video with next chapter.